What's one of the things that's been interesting as you talk to people who are in this space, certainly there are motivated shoppers. You were in the story that you told. But there's probably only 30 to 40% of consumers who probably fall into that active shopper mode. There's been this theory, and one that we have been interested to look at, is in putting some carrots on the table. That when you have price transparency, maybe the way you motivate people, we've had a lot of sticks with deductibles, maybe the way you motivate people is you pay them to go to lower cost options. Do you envision there's ever a future in Medicare and for federal employees, for exchange plans, all things that fall kind of under your purview, or just broadly, if you want to think more theoretically, in which we're starting to pay patients to take advantage of price variation, which research has shown is rampant across the industry?
I haven't thought about the issue of, quote, paying patients, but it certainly would be worth looking at. Obviously, you want to make sure, we'd have to be very careful that we're not getting engaged in any type of fraud activity or steering behaviors. That would be the really probably my outer bound concern, to make sure that we weren't in that, so the paying patient aspect of it. But appropriate incentives, I mean, we do that through high deductibles with an HSA. I like funded HSAs better than just high deductibles. But with a funded HSA, I think you see incredible behavioral change just from that. Trust me, as soon as my employer they funded our HSA, I was very lucky, they funded our HSA. The minute that money made it into my health savings account, that was my money. You couldn't pry that money out of my hands, okay? It didn't matter where it came from. And I think that's a very normal human behavior. So I'm open to thinking about that and approaching it, but